Hi everyone, I want to talk about a familiar topic called heart attack. It is called myocardial infarction or myocardial ischemia in the medical world, but to everyone, everywhere, it is known as heart attack. I will go into details of everything that you're supposed to know as far as heart attack is concerned and even go beyond the basics. And by the time I'll be done, after about 6 different presentations, you will have no reason to ask anyone any question as far as heart attack is concerned. So kindly follow and go through all my presentations in my channel as we continue. Thank you. Ischemia is when there is a decrease in blood flow and that reduces the supply of nutrients and oxygen to the heart muscle. Infarction, on the other hand, means there is a tissue death in that region. EKG could be non-specific sometimes. Sometimes it could be normal, but there's possibility of classical ST depression that will indicate that ischemic process is going on, or if there's infarction, there's possibility of ST elevated myocardial infarction depicted on EKG or non-ST elevated myocardial infarction. It is also possible that there could be no symptoms under a situation called silent ischemia. If no appropriate treatment is instituted on time, it's likely going to lead to death. We are going to come across 3 scenarios. The 3 are grouped together under one umbrella called acute coronary syndrome. And this could be unstable angina, non-ST elevated myocardial infarction, and ST elevated myocardial infarction. Someone could ask, is heart attack different from cardiac arrest, or people just mix the two up? We will discuss that, but before we get to that, we should know that there are risk factors associated with heart attack. There are symptoms. That is what the patient will present with. That's what the patient will tell EMS or tell nurses and doctors at the emergency room. There are signs of heart attack that the nurses and doctors will pick while under their watch. And we will go over acute treatment. We will go over possible investigations to be carried out, laboratory and radiological. History taken is necessary. Physical examination of the affected person from head down to toe. When the patient is well, going home, the treatment will not end there. That's what we call post-myocardial infarction treatment. We'll go over that. We will reveal possible complications, and we need to discuss what are the preventive measures. Like I said earlier, that heart attack is not the same thing as cardiac arrest. Cardiac arrest means the heart is captured, the heart is restrained, the heart is not pumping any blood. And what will happen is that when any individual is having cardiac arrest, the individual will suddenly drop down because there's sudden stoppage of heart pumping ability. There'll be loss of consciousness, and it's going to affect the respiratory system at the same time. That is why it's mostly called cardiopulmonary arrest. If this happens in the hospital, the good people, the nurses, will raise alarm calling code blue. Everybody will come around, doctors, nurses, trying to help the affected individual. If it happens in the mall, at home, anywhere, those that are trained in advanced cardiac life support processes and basic life support programs will be able to use the skill to rescue the affected person. So, from myocardial ischemia, that is partial occlusion of blood supply to the heart muscle, leading to possible complete occlusion and subsequent tissue death called myocardial infarction, then the process to cardiac arrest could be setting in. Another condition is called long QT syndrome, which could progress to Torsades de Pointes, from Torsades de Pointes to ventricular tachycardia, from ventricular tachycardia to ventricular fibrillation, and from ventricular fibrillation to asystole. So if the heart is in trouble, having myocardial infarction and left ventricular function is impaired, and with the help of echo, the left ventricular ejection fraction is low, there is a way to help such people by implanting cardioverter defibrillator. But if that is not done and the individual goes into ventricular fibrillation, there is possibility of sudden cardiac death or cardiac arrest. The commonest cause of cardiac arrest or sudden cardiac death is ventricular fibrillation. We will go over modifiable risk factors in this course of our interaction, and today we will discuss that. The risk factors are just all characteristics that can increase the chances of coming down with a disease. Some are controllable by us if we choose to, and they are called modifiable risk factors. Like you could have seen on the screen, smoking is #1 leading cause of heart attack that you can handle by yourself. You can choose to stop it. There are a lot of nicotine replacement therapy agents right now, Nicodem and the rest of them. I know it might not be a kind of easy decision to make, but it's worth it if we want to live longer. So, quit smoking is a big factor in reducing the occurrence of heart attack. Heavy alcohol, binge drinking is not healthy for our hearts. There is bad cholesterol and good cholesterol. The bad cholesterol is called low density lipoprotein. When that is very high, it's not good for our heart. We are prone to having heart attack. And when we have low level of the good cholesterol, which is high density lipoprotein, is also not good. Sedentary lifestyle is not helpful to us. So get out of the couch. Stop watching the TV for 3 hours in a day. Walk around. It's not all strenuous exertions all the time. Walking, swimming, dancing will help. Stress. Yeah, anger. Make yourself happy. Watch comedy. Play with people. Joke. Feel free. Fear. There are many things. Some people have post-traumatic stress disorder. If there's any way you can handle that, please do. Stress will worsen it. Obesity, the bigger we are, the closer to the grave. Let's find a way to shed weight. Diabetes mellitus without treatment. I specifically wrote that without treatment because if you have diabetes mellitus and you are seeing your doctors regularly and you are compliant, you're taking your medications regularly, it's likely you're going to die of other causes, not diabetes. But if you're not doing that, you are not taking your medications, you're not checking yourself, you are not controlling your diet, not shedding your weight, not exercising, and you have diabetes mellitus, you are likely going to come down with what we call coronary artery disease and have heart attack and so on and so forth. Hypertension, essential hypertension, if you agree with your doctor, you are taking your medications regularly, they titrate it with your blood pressure, or you are young and you now have what we call secondary hypertension, which means there's something wrong somewhere, whether with your kidney, with your endocrine system, and so on and so forth. We are going to look for the cause and we will work with you to put that hypertension under control. And of course, obstructive sleep apnea could also serve as a risk factor for heart attack. The non-modifiable risk factors, just as the name depicts, we can't do anything about it. One, age. The older you become, the higher the chances of having heart attack. Family history. Oh, many of us inherited a lot of things from our parents and grandparents, but at the same time, we do inherit a lot of troubles like heart attack, from them. Now, here is the big question. If my father has died of heart attack, does it mean I'm going to die of heart attack? I cannot say yes, I cannot say no until I've asked you further question on that. And the question is, at what age did your father die of heart attack? If your father has died of heart attack at a younger age of around 50, 55, then you are at a greater risk. And if your mom at age of 60 or below, then the probability is higher. So it is higher if it is first degree relative and the individual dies at a younger age of 55 to 60, male or female. But if your father has died of heart attack at the age of 80, 90 years old, I would rather look for other risk factors in you. Gender. It's common in males, but is increasing in postmenopausal women also. And we talk about race. I don't want to talk about race here because it's actually affecting everybody. We're all in this. It is worldwide. Some literature, some textbooks will tell you that it's commoner in whites, in developed country. Hypertension is commoner in blacks, Hispanics, ladies. Just put all those aside. It is now worldwide, even in developing countries where coronary artery disease was not very common in the past. It is now becoming common because people are now adapting to the new world. The world has become a global village. People just eat stuff, travel all around, eat, live one type of lifestyle different from what they used to live before, take all sorts of things. I learned there's a particular country that I'm familiar with a lot where oral contraceptives have disappeared from all pharmaceutical stores because they've all been taken. And guess what? Few years to come, many will come down with coronary artery disease. So We're going to see again very soon. I will be sending my next video on this subject very soon. Thank you for watching today. Be on the lookout, and you're going to hear from me soon. Thanks. I appreciate it.